So we're here with Colonel Brodes Hartley, who is the CEO, the longtime CEO of Community Health of South Florida, based in Homestead, but throughout the southern Florida peninsula and the Keys. That's a huge area to cover.
Yes, it is. Our service area extends from the airport in Miami to Key West.
Wow. That is a huge area. How often do you get down to Key West to visit the site there?
Well, it's infrequent, actually, but my team is down there more frequently than I.
Uh-huh. That's why you need a good team, right?
Right, absolutely.
Absolutely. So, Brodes, you had a prior career in the military.
Yes, I did.
And joined the health center after that. What was it in your career that attuned you to wanting to manage a healthcare system that cared for the sort of forgotten ones, the poor and the uninsured?
Well, after spending 26 years in the Army Medical Service Corps and having had assignments to various facilities and various, assignments, I decided in 1982, when I was the executive officer of the Nuremberg Army Hospital, to retire. And I came back in December and retired on the 1st of January, 1983.
Mm-hmm.
I went to work on the 4th of January at Florida A&M University as assistant dean in the School of Allied Health Sciences.
Wow.
So shortly thereafter, I got a call from the chairman of the board, who has seen in the alumni news that I was there, and he wanted me to help him find an executive director for CHI. After a very long conversation on the phone, I said to Odell Johns, I might be interested myself. And so, to make a long story short, I went down, was interviewed, and they hired me. And I took that job on the 14th of May, 1984. And I have been there ever since.
Wow. Well, they must have been thrilled to have someone with your experience, your expertise, et cetera, to step in and take over there.
Well, it was interesting because all of the directors who preceded me had been military men, either
Seriously?
Navy or Army.
Wow. That is home base or home to many, many thousands of America's military, doesn't it?
Right.
Wow. Well, when you started there, I'm sure you had your own personal dreams for what CHI could become, but you had to start, as we all do, by tackling the must-dos, the tasks that would be needed to keep the system afloat and above ground.
Yes, yes. When I arrived, we had some financial problems in the organization. And of course, we had to overcome that. We had only 2 health centers at that time. We had the Doris Eisen Health Center, which is located on 216th Street in an area called Gould's. And we had the Martin Luther King Jr. Clinica Campesina, which was in Homestead. And we had 2 outreach programs into the what was called at that time migrant labor camps. That's verbose now. You don't use that term labor camp. It's a farm worker community now.
There you go.
Okay, so that's how we have progressed. But along came Hurricane Andrew.
Oh boy, that was what, 87?
82.
82.
No, I'm sorry, not 92.
92.
Yes.
So you were now just about 8 years into
Correct.
that, but that hurricane devastated
It devastated.
South Florida. I mean, I remember them saying that almost nothing was left standing in Homestead.
Correct. Correct.
How did you handle that?
Well,
And how did your people?
yeah,
your team?
we opened the day after the hurricane, and we were the only people in South Miami-Dade County providing healthcare services. Homestead Hospital was closed. Coral Reef Hospital was closed. We were operating.
Wow.
I often tell the story about one of our physicians, Dr. Knighton. As we opened up and began to clean up debris in what was in our urgent care center, she was helping us to clean up. And she would stop cleaning up to take care of our patients who are arriving for services, because we had a lot of injuries from nails and glass.
Sure.
And this is the way we started operating right after the storm. We had to take up all of the carpet out of our Dodge-Sison Center because most of it was carpeted at that time.
Soaked, huh?
Yeah, and it was soaked. And so, but we were very proud of the fact that even in those difficult times, we were able to institute services immediately with our staff.
That must have given, I mean, not only was it a crucial service,
Yes.
but it must have given a great boost of confidence to those in the community who had felt devastated and forgotten.
Absolutely.
In the wake of the hurricane.
Absolutely. And when we went down to Homestead from the Dodge-Sison Center out to our migrant labor camps, we called them at that time, we had teams to go out and give service in the site, just mobile teams out there working to provide services to those people. But also, we now call that St. Andrew, because after the storm, we were able to get federal dollars under 319 to recover and build new facilities.
Wow.
So after that storm, we built facilities in those migrant labor camps, Everglades and the South Dade labor camp. But we also built the facility in the Ranger as well. So as you see, out of that devastation, we opened at least 3 new sites.
Wow. Well, that must have thrilled the people in those communities.
Oh, absolutely, and we have been growing ever since. I say to my staff, we are always in a growth mode, not only in terms of sites but in terms of services. So we're continuously looking for opportunities to increase the services that are available to our people in that community.
Tell us how CHI has grown from those early days. I assume when you started, it was pretty much clinical medical outreach and community services, but on the clinical side, mostly medical care.
Yes, mostly medical care, but we did have at the time of the storm behavioral health care services. We were early implementation of behavioral health in our primary care centers, and we have grown now. We have 11 health centers, and we are in 35 schools or school-based clinics.
Gee, that's got to cover the bulk of the schools in South Florida.
Well, many of them. We are always looking for the opportunity to increase our presence. We are fortunate in Miami-Dade County. We have a children's trust, which gets funding through taxes, and they provide the funding for our school-based clinics.
Wow.
So that's an opportunity that's not available in every area. And so we are funded, of course, obviously by the Bureau of Primary Health Care, and we've gotten additional new access points through the Bureau. But also, we receive fundings at the state level for our behavioral health care Department of Children and Families, the South Florida Behavioral Health Network, and we receive local dollars through the Public Health Trust of Miami-Dade County. And they fund primarily the Dodge-Sison Center and the Martin Luther King Center. In fact, we are on a 1-year lease from the county for those facilities.
For how many years have you been on it?
well, since the beginning, very frankly.
But I'm sure they're happy to renew every year.
Oh yes, we have been very, very fortunate to have that support, and the support from the commissioner in that area, Commissioner Dennis Moss, and he fights for us at every turn. And his support for community health centers has been unwavering over the years.
That's a
Absolutely.
blessing. Yeah. Yeah. Staff. When you started there, I am sure there was a limited set of staff for the CHI. How much has it grown over the years?
It has grown phenomenally. Matter of fact, we were recognized by Chamber South for our phenomenal growth in our facility. So right now we are able to provide family medicine, pediatric services, OBGYN services, behavioral health care services, including psychologists, psychiatrists, and clinical social workers.
Wow.
So we're very proud of that. We also have dental services at most of our sites as well, and we have a fleet of vehicles. We have a fleet of 32 vehicles
Oh my goodness.
to provide service, because in our area, public transportation is totally inadequate.
Yeah.
Okay? So if we didn't provide that transportation service, the enabling services, those people couldn't even get to us for care. So we have to do that. All right? And most recently, we just bought 8 new vehicles to add to our fleet. So we're continuing to, as I say, always in the growth mode.
Oh, I remember in South Texas, that was back in the early 70s when I was heading the health center down there. We had vans that went out in the rural areas because there was no public transportation there.
Right.
And most of the families, to the extent they had a car, it was an old sort of jalopy that didn't get them very far.
Right.
And so they would often just prioritize using that for essential tasks.
Mm-hmm.
We had to go out and pick up the patients, bring them into the clinic
Right.
and for the care, and then take them back home.
That's right.
Or when they got a referral to a specialist locally or what have you, we had to pick them up, take them to that referral specialist office, and bring them back home. It was essential.
Absolutely essential service.
Yeah, you have to do that.
Mm-hmm.
Post Andrew,
Yes.
I'm sure there have been challenges
Oh, absolutely.
that have faced you, but you have more than risen to the task and the challenge on that. Tell us a little bit about your teaching programs, your education programs for health professionals and others at CHI.
Yeah, we have been in the teaching business for quite a long time. We were receiving medical students from University of Miami, and then when FIU opened their medical school, we were receiving students from them also, get part of their training with us. But one of the things that I'm most proud of is being designated as a teaching health center
Yes.
by HRSA. And we graduated our 3rd class on the 8th of June of this year. And I'm most proud of the fact that our family medicine residents have a 100% pass rate on their boards.
Wow.
So, but let me tell you, the staff convinced the board to name that teaching health center for me. So it's now called the Brodes H. Hartley Junior Teaching Health Center.
Wow. Oh, what a tribute.
And absolutely, I'm very proud of it. And currently we are training physicians in OB/GYN, family medicine, and psychiatry.
Wow.
Now, we will be phasing out in 2020 the OB program, and we are phasing it out because the resources to operate that program are not under our control.
Gotcha.
We deliver at Jackson South Hospital. It's a level 1. Doesn't provide the level of experiences, the acuity that our physicians need. So we have to go to other hospitals such as Palmetto General and North Shore Hospital in order to provide for
Get that level
get
3,
that
huh?
level of service of acuity that they need. So we made a decision that we would phase out the OB program, but continue the family medicine and the psychiatry program.
Okay. Somebody else going to pick up the OB? training?
We don't have anyone to pick that up as of this moment.
Oh, that's kind of a shame. Yeah, that I'm sure is on your to-do list.
Oh, yes.
Find a sponsor, keep those services and the training coming.
Right. And we had to help those residents who were in our training program find other
Yeah.
programs to join.
At the current moment, how many residents are going through the training at
We currently have
CHI?
30 physicians undergoing their residency training with us.
Wow. And has it proved to be a good recruitment tool for CHI?
Yes, it has, and we have been able to retain some of the physicians with us who want to stay with us.
Uh-huh. And I assume that others may have landed at other community health centers around the
Some
country.
did, and some went out into private practice.
Yeah.
We have a good mixture.
You're going to have that. You're going to have that as well. Patient number wise, how many folks is CHI serving today?
Today we serve 83,000 unduplicated users. Wow. With over 263,000 visits per year.
Jeez, that is huge.
We are one of the larger community health centers.
You sure are. Absolutely. Your staff has to be significant as well.
Yes, we have
Overall staffing.
over 700 employees as of this time.
Amazing.
Yes. It's tough to meet that payroll every 2 weeks when you're talking
yeah.
about $1.3 million every 2 weeks.
Yeah, that can be.
And that does not include the fringe benefits.
That is a tough one. But I am sure you have built, I'm sure as CEO, your job and your focus is on building good relationships with the local communities, with the community elders, elected officials, et cetera, and appointed.
Absolutely. The county commissioners in our area, we're serving Commissioner Moss is District 9, Commissioner Daniela Carver is Commissioner 8, and those are the two in Miami-Dade County.
That's the Miami-Dade Unified Government, right?
Right. And they are all strong in support of CHI.
But you still have to build relationships with other Miami-Dade commissioners
Well, absolutely.
who don't represent the area you operate in.
Absolutely. And we have good relationships, not only with our local commissioners, but also with the congresspersons from our area. And Donna Shalala is one of those persons.
Oh, yeah.
Okay.
My former boss.
Right. And of course, she has visited with us, and some of our fundraising events she's attended, like our casino night. She's been there for that. So we have.
She like to play the tables?
Well, she just comes to visit.
There you go. But it's great to see her elected to Congress.
Absolutely.
She is a fighter for women's health issues, for health issues generally.
Right.
From her experience as secretary of HHS, it's nice to have her down there and in your corner, I'm sure.
Right.
She's visited the health center.
Oh, absolutely. And also Debbie Powell has also been a strong proponent of ours.
That's great. Fabulous. And so as you sit there today having to meet that $1.3 million payroll every couple of weeks, how do you look out at the future of your health center and community health centers in general? You see it as a positive?
I think it's positive. Guys like you have been working so diligently with the Congress that we enjoy bipartisan support for community health centers.
Yeah.
And I think that is extremely important. So I think the future of our health centers is good. Yes, we have to go through the budgeting process and the advocacy program, where we have a strong advocacy program. But overall, I think we enjoy the support of the Congress. And I believe that sincerely.
We do. And that is most fortunate. And it needs to be bipartisan because you're always going to have in either party defectors who disagree with some parts of the party's platform, And you've got to have strong bipartisan support. If you get caught in a look what happened to Planned Parenthood or family planning.
Right.
If you get caught in a partisan crossfire, they could take you out in a heartbeat.
Absolutely.
And that's one of the things I'm proudest of with good people like you, Brodes,
Well,
that we have.
I think it's the leadership of NAC. You brought it together, and you protect us. Okay.
It's the leadership and the membership. It is everyone.
Yeah.
Makes all the difference in the world, because who's present to Donna Shalala when she thinks community health centers? It's you. It's not me. It's not NAC. It's CHI.
Right.
That's so crucially important. She will fight to the death
Right.
to keep the program alive for the services that you provide, et cetera. And that is what brings it home for members of Congress on both sides of the aisle.
Of course. Absolutely.
It's what we have to keep fighting for.
Keep fighting. Absolutely. Absolutely.
Colonel Hartley, thank you so much for coming in.
Thank
And thank you for your years of service. 83. That's, or 84.
84.
35 years.
35 years. Absolutely.
Wow. And you're still keeping on,
Still keeping on. The board thinks I'm doing a good job.
They sure should.
So
They should.
kept me, and they did my evaluation in May, that annual evaluation.
Uh-huh.
And they took good care of me.
Came through with flying colors?
Right.
Congratulations.
Thank you.
All right.
Appreciate it.
And good health for the future as well, for you and your family.